I'm Dr. James, biomedical neuroscientist, and welcome to the Holistic Health Coach Corner. Today we're going to be talking about something that's extremely important, and that is how COVID-19 affects people with diabetes. Now, this discussion is extremely important because we need to really talk about the impact of COVID-19 on diabetics today. The American Diabetes Association says that COVID-19 is proving to be more serious than the seasonal flu for diabetics, so you want to proceed with care. The World Health Organization warns that most at-risk populations are older persons and persons with pre-existing medical conditions such as high blood pressure, heart disease, lung disease, cancer, and diabetes. Now, I know that people below the age of 60 have also expired or died in this process, but it's also quite possible that they could have had undiagnosed medical conditions in them as well. And so people with these conditions seem to develop more serious illnesses when they contract the virus. And so recently, beloved American actor Tom Hanks, who is a type 2 diabetic, was diagnosed with coronavirus. He explained in an Instagram post that he's experienced tiredness and body aches, but said he was fine and that he was quarantining himself to avoid giving it to others. Although his case seems fairly mild, news reports like that are sparking further conversation around how novel virus may affect people with diabetes. Now, diabetes type 1 and 2 are a family of diseases that result in too much sugar in the blood, otherwise known as high blood glucose. Now, when your body doesn't make enough of the hormone insulin, which adds to your body getting glucose into your cells for energy, the glucose builds up in the blood, and many diabetics take insulin to help manage those glucose levels. In type 1 diabetes, the immune system attacks the cells in the pancreas that make insulin. In this case, you'll need to take insulin every day. In type 2 diabetes, the body doesn't make enough of or appropriately use of the insulin it has. And so in this case, most common form of diabetes. Diabetes can increase the risk of contraction of COVID-19. When it comes to infections, both diabetes 1 and 2 can increase your risk of contraction. Now, according to current diabetes review, type 2 diabetes can increase the incidence of infectious diseases related to comorbidities. Although more research is needed, diabetes type 1 also increases risk for morbidity and mortality according to other studies. Diabetics have higher rates of complication and death from COVID-19. When it comes to COVID-19, the American Diabetes Association explains in China, where most cases have occurred so far, people with diabetes had much higher rates of serious complications and death than people without diabetes. But why might COVID-19 and other viruses be so risky for diabetics? Well, let's dive in. Dysfunction of the immune response makes diabetics more susceptible to infections. For one, it's thought that hyperglycemia, which occurs when you have high levels of sugar or glucose in the blood, in diabetics may be a cause of dysfunction of the immune response, which results in failure to control and spread of invading pathogens in diabetic subjects, making diabetics more susceptible to infections, according to the study published in Current Diabetes Review. We have to understand that damage to the circulatory system in diabetics slows healing. Now, Sarah Sato, a nurse practitioner for the Alpine Center for Diabetics, explains further, some diabetes patients have damage to the circulatory system, which slows the healing effects of the blood from getting to and from those areas. Some diabetics might experience delayed healing when someone with diabetes is fighting off an infection. For example, it leaves the body vulnerable. Sometimes if the body is experiencing inflammation related to uncontrolled high blood sugar, then the inflammatory response of the body can slow the immune response to new threats. To make matters a little complicated though, There probably isn't too much of a difference in how the virus plays out in people with type 1 versus type 2 diabetes, according to Dr. Robert Gabby, Chief Medical Officer, Joslin Diabetes Center in Boston, the global leader in diabetics research, care, and education.